Pharmacology is one aspect that people are having some challenges when it comes to studying some of the medications. So today we are taking metformin and we are bringing it down to your level for you to understand metformin. And there's some examinable questions about metformin medication on the NCLEX board exams. Okay, metformin is a veganite. Okay, it's in a class group of veganites. Veganites. Okay, so metformin decreases glucose production by the liver and increases tissue response to insulin. So that's what metformin does. So it means that metformin doesn't produce insulin. It doesn't stimulate the production of insulin. Then it certainly means that it has little, effect on a patient for it to cause hypoglycemia because it doesn't actually produce insulin. It rather works on the liver to decrease the production of glucose. So knowing all this, it means that we can still give metformin to clients that can skip meals. Ideal drug the healthcare providers or the doctors give to clients with DM type 2 DM when they are going home. Then they take metformin because they take it depending on your prescription. Some of them take 500 milligrams, some of them take 1 gram, either morning and evening, or only morning or only evenings. And it's a daily something you take. Why don't we say that patients should be checking their glucose every day? They should checking their sugar levels every day, sugar levels every day. It's because of the work of metformin. It doesn't actually cause production of insulin. And when insulin is too high, that's where it picks up the sugar from the blood and take it into the tissue. And we have a likelihood of getting hypoglycemia. But metformin doesn't cause that. Okay, that's why we can give it to patients to go home and be taking it on a daily basis. And then also once in a while, be checking their sugar. Some of them don't even have their glucometer to be checking their sugar, but I still take metformin anyway. Yeah, so that's the reason why we are confident to give metformin to clients and then not to worry about the fact that it is going to cause immediate hypoglycemia if they don't eat. So one thing the boards test if it comes to metformin is the fact that metformin is withheld 48 hours before and 48 hours after any procedure that uses a contrast dye. So it means that if a patient is going to theater, if a patient is going for cardiac catheterization, where they are going to use any contrast dye, patient is going for CT scan, where they are going to use a contrast dye, and the doctor lets us know we are going to withhold metformin 48 hours before we take such a patient to for the procedure, because if we give metformin and then they go for the procedure and they also give contrast dye, now both drugs are being excreted by the kidneys. So the kidneys will now pick up the contrast dye and use it. Then metformin becomes very toxic in our system. It's not going to be used. It's in the system because it's not. It's not being excreted. It is in the system and it causes lactic acidosis. So that's why we don't give metformin to clients that are going for contrast medium and any procedure that they use